Good evening, everyone. I'm so happy to have you guys here on this program, on this platform with us. Tonight, we're going to be discussing disease, symptoms, and deficiencies. Doc, I would like to know if there, maybe at the end of this program, if we will be able to answer some questions from the last episode that we had, because I had a few questions about that. So maybe coming on to the end, we will be able to discuss that, if that's okay.
I don't think so, because this topic, let's try to address the question limited to the topic we present.
What we have on the table to discuss is deficiencies, symptoms, and disease. First, I would like to know, what is a disease? What is considered, what is the definition of a disease?
Usually, when you, a disease is a dysfunction, it's a disorder. Your system is programmed in such a way that there's what we call the homeostasis. The homeostasis is a set of functions that are established to maintain a certain balance in the body, so that the body can function and you don't feel it. Absorption of nutrients, respiration, circulation, everything is in place. And the whole principles that maintain those functions is what we call homeostasis. The body is all the time striving to maintain a general balance, and that's what makes the person feel healthy. So let's put it this way in a layman term so that everybody can understand what I'm talking about. Disease basically is what we call a rupture of those functions, a disorder of those functions that contribute to the balance, to the homeostasis of the body. So, and the body has a tendency to always attempt to return that balance that we call health.
What is the connection between symptoms and diseases?
Well, the connection, disease is a disorder. If, for example, you're not having enough oxygen in your brain and you have shortness of breath, the brain is extremely highly sensitive to the presence of oxygen. If you have shortness of breath, that means you're not getting enough oxygen going to your lungs. And if you're not getting enough oxygen going to your lungs, the alveoli, the capillaries that were supposed to capture the oxygen through the air that you absorb, if the moisturization of the alveoli in the lungs doesn't take place, you have dry lungs for some reason, and the amount of oxygen that you're supposed to intake is not sufficient, you're going to have headache, foggy brain, and when you have experienced those symptoms, and you may even pass out. When those symptoms, this is the symptom, is the sign, the manifestation of a dysfunction. A disease is a disorder. A disease is a dysfunction. So the symptoms will express itself with headache or you pass out. The sign, the manifestation of that disorder is the passing out, is the headache. So the headache is a sign, is something, the symptom is what the patient subjectively experience. When you pass out, for the doctor will see that symptom as a sign. And this is an objective observation of a symptom, of a manifestation of a behavior that will indicate to the doctor that there is something going on. From that moment, he will begin in his mind to explore anything that could be connected to the sign. Sign is the objective interpretation of the symptom by the doctor. Symptoms is a subjective manifestation or experience, subjective experience of a disorder. A disease is a disorder, a disease is a dysfunction, a rupture of a continuity in the continuity of a function. That means the function ceases to
Okay, Doc. Good evening, Doc. As you just talked about the connection between the symptoms and diseases, the question is there a relationship between causes or metabolic processes and symptoms? So ratio between causes, metabolic processes, and symptoms. Can you shed some light on that, please?
Absolutely. What the key purpose of our meeting tonight is the fact that there is all disease. What we need to, if we forget everything tonight about the discussion, what we need to remember, all diseases are connected with a deficiency, with a specific deficiency. We just saw it. When we said that there is not enough brain, enough oxygen going to the brain, we're talking about deficiency. And that's why the person has a headache or pass out, and other that can cause also stroke. When you experience stroke, it's the same thing. We are in infarctus is when, for some reason, there is not enough oxygen reaching the brain, and some area of the brain stop receiving the proper irrigation of blood, the flow of blood, and then the system shut down. You see, there is always a deficiency. A deficiency is the absence of something vital for the system. So when you ask me the question, the connection between metabolic processes and disease. A disease is what I was saying, a rupture in the process, in the continuity of the process. What is a metabolic process? A metabolic process is a process. Of course, a process is a succession of steps in the manifestation in the process. Let me explain. When you eat your bread is a polysaccharide. It's going to be mixed in your mouth with saliva, and it's going to break the polysaccharide into monosaccharide. Glucose, the bread is going to carry glucose. The glucose must be broken down and in different stages. And at the beginning, there is the initial molecule of glucose, and you can have two types of pathways, metabolic pathways. The metabolic pathways is the cluster of biochemical reaction through which you can break down a molecule and for the body to process it and absorb it and internalize it so that it can become part of the body itself to maintain, to provide energy. That's the way it goes. You eat to provide energy to your system. Now, that molecule of glucose will reach, if the origin of the food, the provenance, the source of that glucose come from alkaline food, because you have acidic food and alkaline food. If that glucose comes from alkaline food, it will be metabolized, it will be processed, it will be inserted in a succession of biochemical reactions that will take that molecule of glucose to the mitochondria. And when it reaches the mitochondria, it will reach as pyruvic acid that will enter the Krebs cycle. And at the end, it enters the mitochondria as Krebs cycle, as pyruvic acid, and it gets out as ATP. ATP is what we call adenosine triphosphate. According to the South, to the origin of that molecule of glucose, if it comes from an alkaline source, it's going to deliver approximately 32 ATP. But if it comes from let's say, acidic source, that molecule of glucose will deliver only 6 ATP. What does that mean? We have to make it clear for everybody. Alkaline food, what kind of alkaline food? What do we talk about when we talk about alkaline food? Alkaline food is when, for example, you eat your Brussels sprout. Well, Brussels sprout is alkaline food. And you have, let's say, celery is alkaline food. Dandelion is alkaline food. Those are food. And when you eat your, let's say, your millet is alkaline food. But if you eat your rice, it's acidic food. We didn't know that. Yeah, so if you take the same molecule of glucose, but the rice that you eat is starch, it's acidic. But millet is not. It's alkaline. But what is the difference between millet and rice? Well, millet is going to give you all the minerals that you need. It's going to give you most of the essential amino acids that you need. And when you combine millet with black beans, you get a full meal. A lot of people, if they were smart, that's the way they should eat. But they don't eat like that. They will eat rice, beans, chicken. When you eat like that all the time, you put a lot of acid in your system. And the type of glucose, you can now break down the glucose into an acidic pathway. And you will be producing only 6 ATP at the end of the process. But when you eat millet and you have steamed vegetables with your millet, and you have, let's say you can have some fish, that's what we call white meat. It's not red meat, it's white meat. Well, you have a lot of chance to end up with your 32 adenosine triphosphate ATP for each molecule of glucose. Phenomenal. So your mitochondria, you feel stronger, you get a higher level of energy because you select your food. Now, the metabolic process that takes place, for each food, for each molecule of glucose that you eat, you're going to produce what we call metabolic waste. The metabolic waste, if the food that you eat it from an acidic source, you can imagine how much metabolic waste you're going to create in your body. So each time that you eat your bread, you eat your rice and beans and chicken and curry goat, all those things that are extremely palatable for us, we are poisoning our blood. You see, that if you take the vegetable salad, you take your millet, and you take your fish, it's 2 different food. 2 different food. So now that you find yourself in that situation, you are having your alkaline food, you produce less metabolic waste. What are those metabolic waste that you produce in your body when you eat from an acidic source? You produce 1 molecule of glucose will cause you to produce triglycerides, cholesterol, ethanol. Ethanol is an alcohol. So you may end up with a cirrhotic liver by eating bread all the time without drinking alcohol. So that's how we hurt ourselves. We don't realize that. But it could be cultural. That's what I explain very often to people that end up with slavery diet. And you have a lot of, particularly people with brown skin. I don't call my people black because they are not black. Only the red dogs call our people black. They are not, and they are not white. They call themselves white. But I don't call my people with brown skin because we have been slaves. They have developed what we call the saccharine disease because they eat a lot of starch. And because of that, most of the time they are impatient, they are hot-tempered, they have low patience, they have no tolerance, and they are extremely the tendency is to take control of everything. It's a aggressive attitude, and it's very difficult for them to be together, to team up. It's the connection. I consider that as part of the metabolic way, because when you eat a lot of starch, you produce a lot of alcohol. When you have a lot of alcohol in your blood, the alcohol doesn't come from liquor, it comes from the food. Because for each molecule of glucose provided by an acidic source, you have triglycerides, ethanol, and high cholesterol. That cholesterol must go somewhere. You need cholesterol to structure, to synthesize your hormone. But too much of it can cause some serious problems, because that cholesterol will bind itself with calcium and create deposit in your artery. So that is going to give you high blood pressure. The same with the triglycerides. Okay, and don't forget about the ethanol that is going to give you a plastic liver. And when you develop a cirrhotic liver, your liver turns into plastic. And that thing happened to a lot of us. So what is going to happen? The liver will not be able to transform the amino acid to the transaminase, because you find transaminase, which is a specific type of enzyme that transforms one amino acid into another amino acid. All right? So when that happens, you face a serious issue, because we have a lot of biochemical reaction in the body that result that are dependent on the transformation of one amino acid into another by the transaminase. So when there is a scarcity of those type of enzyme transaminase, you're going to end up with some serious disease. You might be able to sleep during the night because you don't have enough L-tryptophan. Okay? If you don't have enough L-tryptophan, you cannot have the serotonin, the melatonin that you need to sleep well, because the tryptophan is the precursor of the melatonin. This is phenomenal, the way the body works. So yeah, so that's why when you really think about this, all people, when they say that you can't sleep, nobody comes to tell you you should take L-tryptophan. They're going to give you Ambien. Ambien has nothing to do with L-tryptophan. Ambien is going to shut down the sympathetic nervous system and to try to shut down your nervous system and to force you to sedate you, to force you to sleep. But it doesn't address the scarcity, we say the deficiency of L-tryptophan that you need. And all those connections refer us to the nutrients, to the food that we eat. You don't have the enzymes, the disease show up. So that's why at the beginning I said, let's talk today about the deficiencies, okay? The deficiencies and disease. So all diseases are connected to a specific deficiency. So that's why your question is extremely deep. That's why I have to go far to bring it to you. So what is the connection between disease and metabolic processes? This is exactly what happens. I'll give you something concrete that you could connect with, the food that you eat. For example, if you eat and you are stressed, the stress shut down the ability of your stomach to produce the enzyme that you need to bring the food. That's why a lot of people, but the body shut you down before you make that mistake. Some people, when they are stressed, they eat a lot. Some people, they can't eat when they are stressed. So the reactions are subjective. But the same way, when you eat too fast, you don't chew your food long enough in your mouth, because it has to do a lot with the enzyme. You need to give time to your saliva to be produced, to mix itself with your bread, because the bread, the digestion of your bread starts in your mouth. it doesn't happen in your stomach. The bread, your body will catch up with the bread when the bread reaches your duodenum. But in your stomach is equipped to break down your meat, your cheese, your protein. So that's why you have to take time to chew your food at least 30 times in your mouth, so that you feel the saliva melting completely the bread or the plantain or anything that is starch requiring amylase to be digested. Take your time and chew it in your mouth. Even your meat, you can take time to chew it several times. The grinding that will bring it into pieces in small size, infinitesimal size. The saliva will dissolve it and then bring it down to your stomach. And that will multiply what we call the contact surface, so that the enzyme can have a grasp upon the food. It's beautiful the way God created it, but we need to have that kind of
the knowledge
to learn and to understand.
And then the knowledge, yeah, because I mean, coming back to where you're saying, Doc, where you said again, in school we learn that digestion begins in the mouth, but so often we're rushing to eat because we're going to work or we're finishing a break or something like that. So we're not doing 30 chews, we're doing maybe 10 and we swallow it. So that's where we also could deal with the deficiencies with the nutrients, because we may eat the right food, but if we're not taking time to digest it properly from the mouth, I guess that's where also deficiencies come about as well too.
Exactly. When it has not been digested properly, that is going to create fermentation in the stomach and also creating allergic reaction and inflammation. A lot of symptoms. Yes, that's how the body works. So that's why I said this type of discussion, when we have it, young people, elderly people, mother doctors. You see, when you go to medical school, you don't go to medical school to associate those things with your daily life. You go to get the diploma. And when you finish, you forget about all those things that you never connected with daily life. And after that, you enter into your pharmacology, and then you forget about all those steps. You see, that the patient need to understand. And even the doctors, after they get the diploma, they forget about those steps. And you find a lot of doctors obese, a lot of doctors smoking, a lot of doctors, completely off because they never perceive that information as pertinent regarding your personal life, your daily life. Do I make sense?
Yes, we are following completely. As we discuss, thank you for shedding some light on the metabolic process, relationship between metabolic process and symptoms. Is it fair to assume then, or you can correct me, that two or more different dysfunctions or metabolic process can be associated with the same symptoms? Can the same symptoms be found in more than one dysfunction within the body?
It's a smart question. What I see there is that, yes, the answer is yes. And the answer is yes. I'm going to give you two examples. People that suffer with hypothyroidism, H-Y-P-O, thyroidism, and people that suffer with Cushing disease, which is a disease of the adrenal gland. Those people suffering from two different diseases. A disease presents a pathological process that there's a set of reactions that have been disturbed, disrupted. What happened? Hypothyroidism is a dysfunction of the thyroid gland. Cushing disease is a dysfunction of the adrenal gland. So we're dealing with two organs presenting a dysfunction. We could objectively expect that the symptoms should be different. That means the patient would observe that when the thyroid is not functioning, the patient would observe a certain cluster of symptoms. But guess what? For both, the symptoms are the same. What do we have when you suffer with hypothyroidism? You have high blood pressure. When you suffer with Cushing disease, you have high blood pressure. When you suffer with hypothyroidism, you have a coarse voice. And when you suffer with the Cushing disease, you have a coarse voice. When you suffer with hypothyroidism, you end up with dry skin. And when you suffer with with Cushing disease, you suffer with dry skin as well. Let's take those three signs, those three symptoms. And that's where the doctors can find himself in a situation that makes it difficult for him to make a decision. Of course, the doctor can have to run tests. He will do that to establish a correct diagnosis. But what he will face is the difficulty to address the symptoms. Okay? A coarse voice, how are you going to address that? Dry skin, how are you going to address that? High blood pressure, how are you going to address it? But those symptoms refer to two different organs, to two different dysfunctions. Well, the doctor will come in the picture and say, we need to address the symptom. Certainly, you will have to prescribe something for the high blood pressure. He can recommend a kind of cream for the skin and maybe suggest something for the voice. But when you address those symptoms, okay, are the pathological processes addressed? Because we're dealing with a thyroid dysfunction, we're dealing with the adrenal gland dysfunction. So my answer to you is to tell you the medical strategy here is paralyzed. In that sense, we're dealing with symptoms, identical symptoms that reflect two different pathological processes. The high blood pressure medicine is not going to fix the problem. The steroidal cream is not going to address the problem. And the recommendation for the throat is not going to solve the problem. But when you run the test, the imaging test, or the blood test will reveal the missing nutrients, the deficiencies. And then instead of prescribing the cream or the high blood pressure pill, you're going to address the cause, the processes that are connected to the thyroid and the processes that are connected to the adrenal gland. It's a two different ball game. So you don't address, then the doctor will be able to address at the same time the symptoms and the processes. That's what a good doctor would do. So that's my explanation. My answer is to tell you, yes, two different causes can present the same symptoms. And that can be confusing for a young doctor. That can be confusing.
Doctor, oh, sorry.
Go ahead.
I have a question as it relates to drugs and symptoms because, you know, when we go to the doctors, we get drugs. And I would like to know what is the connection between drugs and symptoms?
Well, most of the time, the drugs are perfectly designed to suppress symptoms. And let's take an example of painkillers. Okay, if you go to the doctors, you are in pain, and you suffer with a lot of people when they are headaches, they take Tylenol, or they don't even go to the doctor. They go because those are OTC, over the counter medicine they can find. They take painkiller, but the headache can be associated with the liver. The headaches can be associated, for example, if you have a trigeminal issue, trigeminal nerve issue, which is you have in your neck 12 pair of cranial nerves. And the cranial nerve, the pair number 5, is what we call the number 5, the trigeminal nerve. And that affects you when you go to the dentist and you have an infection and you have a tooth that has been removed. And in that area, or you get gums inflammation, gingivitis for long term. And you have that pain that is excruciating. And that is going to affect your parietal area, the maxilla, the mandibular, all those structures of your face will be affected by the pain. So, and many times we don't associate those pain with the cranial nerve number 5, the trigeminal issue, and you're looking for the solution. Okay, the example that I know about this is that's very strange. The first reaction of the doctor is to alleviate your pain and to stop you from suffering from your condition. It can suggest 2 types. It depends on the severity of the pain. It can suggest some painkillers. And most of the time, most painkillers are opioid medication. You have weak opioid medication and you have strong opioid medication. It's important for us to know those things. If you take Tylenol, let's take Tylenol. Tylenol, we consider Tylenol as the pain. That's what we call acetaminophen. Acetaminophen. And Tylenol is extremely dangerous because Tylenol shut down your glucagon. And your glucagon is what helps you protect your body against cancer. So if for your pain, without consulting your doctor, you continue to take Tylenol, and you take Tylenol freely because it's OTC, that means we can go and get it over the counter anytime, you're going to shut down your immune system and you will expose yourself to cancer. Because the glucagon is part of what we call the apoptotic process, apoptosis, the apoptotic process in your body. That's the first line of defense of your body against cancer. Or you choose to take Tylenol to shut down your pain. Just to give you the explanation when it comes to that approach regarding the way you try the drug and symptoms. That's the connection I'm trying to make for you. So you try to shut down a pain, just that. Tylenol is its fault. But that drug is going to shut down a specific process that protects you against cancer. Okay, Tylenol will give you a break at least for 3 or 4 hours, okay? But the pain will come back. So you're going to take Tylenol again. Or you take Tylenol every night to sleep. You must be out of your mind. You'll end up with a weak immune system and with some severe complications. So to take the drug suppress the symptoms, but it doesn't stop the process. The same thing with surgery. You have breast cancer. Okay, they're going to give you anesthesia. They're going to remove the breast. Okay, they can perform what, a lumpectomy, or a full removal of the blood of the breast. When this happens, do you think the cancer process is stopped? No, they just remove the breast, but the condition that created the breast cancer still remains. They didn't change it because we're dealing with a metabolic process. So the drug can be perceived as a bridge to maintain, to remove the pain and to help you function. It helps you by time. That's what we should understand. And that's why I find it necessary for us to be educated when it comes to health. And that's why I'm having that health retreat in March 15 to March 26. People need to understand that. A lot of people, oh, I'm cancer-free. Yeah, you're cancer-free locally. But all the acidic condition, the acidosis that create the cancer is all over your body. The surgery didn't remove, didn't change your metabolic acidosis. So the drug removes the symptoms, but it doesn't stop the process. That's the first thing that we need to understand. And you cannot go to the doctor and ask the doctor to stop the process. First of all, he doesn't know how to do that, most of them. And second, is not his responsibility to stop your process. His responsibility is to give you a break, to help you. And that's why it's important to go to the doctor. But the doctor is not responsible for your lifestyle. Some doctors are motivated. They are interested in your well-being. They will then invite you. When he talks to you about lifestyle, he's not performing a medical act. Your lifestyle is your business, is your education, is your health education. It's up to you to learn. And don't ask your doctor to be your health education. He's your doctor to address your emergencies, your mistakes, and to reveal to you the dysfunction of your body when you don't understand what's going on. So I encourage people not to expect too much from their doctors, but I ask them to go to the doctors because the doctors spend time studying to have the knowledge. Me, I choose to educate. So that's why I'm giving those sessions. And at the same time, I'm helping the general public to get a better perception regarding the management of themselves, the management of their health, and how they can use the conventional medical system as it is, and on the other side, for them to take responsibility to consult with Keny International Educational Health Center that can educate them about themselves. So it's clear that there is a specific connection between drug and symptoms. The drug is important, but the drug is not the solution. It's a temporary relief that is given to you to adjust the situation. So now let's go back to the trigeminal issue. When you have that pain and that headache, that is excruciating because you feel it in your temporal, in your parietal lobe of your brain. You feel it in your mouth. This is crazy. You can sleep, you feel it in your eye, and it's painful. What is going to remove that? Of course, the doctor can prescribe a strong opioid. He can give you tramadol. He can give you methadone. He can give you even diamorphine or fentanyl. All those painkillers out there, they can help you with that. But trust me, that's not going to solve the problem because that pain will continue. Because that's something that has to do with your bone marrow. That's something that has to do with specific deficiencies. Remember that I told you that most diseases are connected with deficiency. So you are more prone to the deficiency or dysfunction of the trigeminal nerve, the cranial nerve number 5, when you don't have enough B12 in your system, when you don't have enough B6, when you don't have enough methyl sulfate, all right? So when you don't have enough iron, Those are specific nutrients that cause that nerve to collapse. The painkiller will help with the pain, but will not replenish the missing, will not take the place of the missing nutrients. Isn't that phenomenal? And that's what a lot of people, they keep going to the doctor, they keep going to the dentist, they keep but the deficiency persists. The doctor will not prescribe that because he doesn't know that. He doesn't know that. Even your dentist doesn't know that. The dentist will give you a painkiller, but he will not tell you because he is not a metabolic medicine doctor. You have to respect. That's why when you go to the doctor, you expect so much. And when the doctor tells you, oh, don't go and take those vitamins, he doesn't know crap about those things. But the new studies, automolecular medicine, clearly established that when those symptoms appear, you need to look first. Yes, you can prescribe the opioids to shut down the pain, but you need to verify, to try to identify the deficiencies. And those are specific deficiencies. You would not expect that B12, methyl sulfate, would be important when it comes to your trigeminal nerve. Yes, they are important. And that's why sometimes I recommend when you have those pains, okay, take your opioid, take your Tylenol, take your tramadol, take your hydromorphone. Those are painkillers. But what do you expect? That's not going to replace what is missing. Chlorhydrix, which is a liquid that corrects anemia, that bring you B12, that bring you methyl sulfate, that give you iron. That type of drink, that type of natural stuff can give you a break while you're taking your opioids. That's what we need. This is the type of education and open mind that we need to develop, so that we develop a kind of intelligent approach, an educated approach when it comes to the management of your home health. It's 8:21. I will stop within the next 9 minutes.
Not a problem, Doc. We're actually closing it off or coming up to the conclusion now. So again, very detailed discussion, and clearly we've seen that drugs are basically like a plaster on the bruise and actually treating the root cause, which is, again, like you said, the deficiencies. And I mean, we really appreciate you talking, and definitely have to improve our knowledge on the nutrients that we need for the metabolic process in our body as well, because that's what we started the conversation about, making sure we have the correct nutrients to ensure that the process are working the way it's designed to, or else we will have a lot of symptoms and deficiencies occurring in our body for sure.
Absolutely. And what I can say to that, to reinforce the idea that the deficiencies are serious that can be. For example, a lot of people suffering from miscarriages. The woman cannot give birth. They have all types of fertility treatment and it doesn't work. But they have HRT, which is hormone replacement therapy. They do a lot of things. But what I've never heard of, that if those ladies were supplied with manganese, one element that is extremely important when it comes to the nidation of the egg against the lining of the uterus, to connect the egg to the uterus so that the embryo can develop. They become pregnant, but they can't keep the baby. So the hormone replacement therapy works to a certain extent, but they lose the baby and they keep losing the baby because the nidation not take place. That means the egg cannot attach itself to the wall of the uterus. So a lot of miscarriages are caused by a deficiency of manganese. Yes, so many women that are sad in their relationship and they cannot be pregnant only one thing is missing. And they have done everything. So don't you think they should come to the retreat? They should come to the retreat. That would solve so many problems for them. And because they're spending a lot of money for foolishness, and there you have a retreat like that, 10 days, March 15 to March 25th, in a wonderful place. You got the Atlantic Ocean with the fresh breeze, a massive concentration of negative ions in the air alone, and you walking your 10,000 steps, reversing all disease of your body. It would be foolish not to show up and to spend 10 days, not to miss so many important concepts that is going to help you for the rest of your life. Because each retreat is different. This one is specifically about sexuality, nutrition, and sexuality is about the gender. If you're a man, you're a woman, you need to know, as a man, how to feed yourself, how to be yourself. And you need specific nutrients for that. You need specific nutrients for your testicles. You need specific nutrients for your ovaries. You need specific nutrients for your breasts. You need specific nutrients for sexual performance. You need specific nutrients for your kidney. You need specific nutrients for your prostate. What is causing so many diseases? Deficiency. And you have a retreat like that, and you say, from the moment that you find an opportunity like that, you drop everything to be there. So that's why I said, those retreats, we don't repeat them. I'm not going to repeat this. I'm going to bring this one time for the year. After that, there are so many topics to address. So that's why it would be the biggest mistake of someone's life to miss something like that. You see, look at that little conversation that we have in a short time. In a short time, look at, you see, you begin to see really that there are a lot of things that you can change by acquiring a better understanding of how the body works. The doctors have the responsibility. You have yours. The only thing killing us is our ignorance and stupidity. You see, yes, that's what it is. Mm-hmm.
Well, Doc, as we bring this to a close, I'm not sure if any other participants in the Zoom meeting have any questions for you, our last 4 minutes of the meeting. But definitely, as you said, the retreat is something we don't want to waste for sure. But the other retreats and deficiencies.
Yeah, we can't miss that. Yeah. Yeah. So apparently, it's important for us to see the connection. The drugs are a bridge. Don't come to tell me I'm taking metformin, so my sugar is under control. Don't tell me that I'm taking amlodipine and my blood pressure is under control. You're fooling yourself. You're fooling yourself. Amlodipine doesn't control your blood pressure. It maintains it at a certain level, but all the dysfunction that caused the blood pressure still continue to destroy you. And the amlodipine is going to destroy your kidney. When they put you on dialysis, then you say, what? I'm on dialysis. And when you're on dialysis, your immune system shuts down. And you begin to develop a lot of ulcers that cannot heal. And your skin begins to deteriorate. Your liver begins to shut down. That's the type of miserable life that you want. Yeah, nobody wants that. But what is because the blood pressure is there. The first thing that's missing is oxygen in the brain. And then you can have some serious obstruction or blockage at different level of your system that interfere with the blood flow. And it could be also that for some reason that the left ventricle of your heart, the myocardium, the pericardium, the endocardium, all those heart muscles are not performing at their best optimal level. And you may have some also respiratory issues that cause your alveoli to not absorb the proper amount of oxygen that we need. Chronic hypoxia. There are so many factors involved when you suffer with high blood pressure. So that's why I said, here again, you see the deficiency. So the blood pressure is a drug, but that doesn't fix the deficiency. And that's why people need to be educated, and you need to be patient with yourself to take that time to be educated and to learn and to learn and to learn. There is no quick fix. Don't expect that, and don't think that you satisfy, oh, I'm taking my blood pressure medication and I'm good. Good luck to you, because you're destroying your body with your same blood pressure medication. All right? The same way people taking metformin. And now, don't you see, back and forth, FDA are telling people now, we remove metformin from the shelf because metformin is causing pancreatic cancer. And there are a lot of people in the Caribbean that don't know anything about that metformin has been studied to cause pancreatic cancer. And when you have pancreatic cancer, you can die within 2 months. 2 months, and you're taking that for years. And most of the time, you don't know that you have that pancreatic cancer until you go to the doctor, and the doctor say that you have the pancreatic cancer, you're going to die. And the doctor kills you by telling you that you're going to die. That happens to a lot of people. They have been living with the pancreatic cancer for years. And when they learn it, the fear shut down the immune system completely, creating a disruption of the balance. That's why we talk about the homeostasis, the ability for the body to compensate it, to maintain, to preserve a certain balance. And then in 2 months, the person is dead, gone. After living 5, 8, 10 years with the same dysfunction, the fear, and the word cancer. So what we're teaching right there again, when you come to that retreat, you will learn how to address those crises. That's what I have to tell you. So
Okay.
bring them all to that retreat.
So, Doc, in a nutshell, a deficiency can cause a dysfunction. Dysfunction can lead to symptoms.
Yes and no. The deficiency always create a dysfunction, but not all dysfunction present a symptom.
Okay.
Yes.
It may present a symptom. Okay. Okay, got it. Okay.
Because you may have dysfunction, you may have asymptomatic dysfunction.
Yes. Okay, I got it. Got it.
Let me very quickly. Your liver, for example, you may be sick with your liver for 10 years. You never feel anything. There is a dysfunction, but you have no symptoms.
Yeah.
Because the liver can compensate. You can have 10% of your liver functioning well, and the 90% is off. You don't feel anything. Everything seems to be going until the whole system collapses. Got
it. Thank you so much for the very informative meeting tonight. And I look forward to more meetings like these. And I encourage everyone to come to the retreat as well. I am sure they're not going to leave the same.
You the first.
Me, yeah, I'm the first. I am there. I will be there.
Okay, thank you.
Thank you so much.
It's been a pleasure to be. Thank you. It's been a pleasure.
Good evening, everyone. Thank you, Doc.